Thank you, Ellen, and thank you all for being here today on the very rainy morning, and for everyone who's joining via the internet. I appreciate the opportunity to speak to you today. As Ellen said, I'm Anthony Signorelli with the Advertising Council. I've had the pleasure and fortune of actually working there for the past 12 years, and have worked on the issue of childhood obesity since my time there in 2001. Today I'm just going to present a case study for some of the work that we've done more recently. Like I said, we've been working on this issue for some time, and it has evolved over time for obvious reasons. So this will be a snapshot, but I'd be happy to talk to anyone after about some of the other work we've done or questions about what I do present today. Just to give you all a little bit of quick background, the Ad Council, we're a nonprofit, a 501c3. We were founded back in 1942 by FDR, and he once said, when giving remarks, you should be sincere, be brief, and be seated. So I'm going to take that advice today and use hopefully just up to my 15 minutes of time that I have. Our mission overall is to identify a select number of significant public issues here in the United States, to basically address those issues through communications programs specifically. So while we know many issues involve the built environment and policy, our focus really is on the message environment solely. And those programs need to make a measurable difference in our society, so we don't take on issues that we don't think communications actually have the ability to move the needle against. You're probably most familiar with some of our iconic campaigns, such as Smokey Bear, the Crying Indian, McGruff the Crime Dog. So we've been addressing very pressing issues over the years, like I said, since the 40s, all the way up until today, including childhood obesity, autism awareness, things like bullying, cyberbullying, texting, and driving. This is just a snapshot of some of the issues that we do address in the health, safety, education, family, and community categories. I've had the privilege of working primarily in the health space for a number of years, but I also work on some other issues across the board. The Advertising Council is a bit of a misnomer today. Like I said, we were founded in 1942 actually as the War Advertising Council during World War II. Eventually the name War was removed and we remained advertising. But I know when we talk about the message environment, it's so important, especially today, to talk about much more than advertising. And we as an organization really are a communications firm. And we look at the target audience, we look at the issue that we're addressing, and we really try to develop programs that surround that audience in the best way possible. So a lot of the work that we do is public service advertising, but we build websites, we work in the social media space, we work in the schools, we conduct events. So advertising is part of it, but it's not the whole story. And lastly, about the Advertising Council, one of the, I think the greatest value propositions that we offer to the nonprofit and government organizations that we work with is our ability to secure media for them at no cost. So any of the messages that we develop are put out into the marketplace in a donated media environment. We work with all of the major companies, from the Time Warners and the Clear Channels and the Comcast all the way down to the local community, the local radio station, the local newspaper, work with many bloggers and websites. And our relationships with them amount to $1.5 billion with a B in donated media support annually. So where that puts us as an organization is probably within the top 5 advertisers in this country if you roll up all of our organizations together. So we speak with a pretty big voice on behalf of a lot of worthy organizations and causes. And as I mentioned earlier, our mission is really focused on making a measurable difference. So all of the work that we do is very research-based, both from a formative standpoint, so understanding the right way to communicate to different audiences and the right channels to do it, but also on the evaluation side, so measuring key components like exposure, recognition, engagement, and ultimately, are we having an impact on the issues that we're addressing? So that brings me to the case study that I'd like to share today on childhood obesity prevention. As I said, we've worked on numerous projects. The one I'd like to talk to you about here is a program that we developed on behalf of the First Lady's Let's Move program. Basically, we had been working, I would say, for about 7 or 8 years with the U.S. Department of Health and Human Services as well as the U.S. Department of Agriculture on 2 different but complementary campaigns. The work with HHS was focused on childhood obesity prevention, and the work with USDA was focused on nutrition education. And so we saw the opportunity with the Let's Move program to bring both of those programs together, to develop this sense of collaboration that the First Lady envisioned, and to develop a campaign that reached multiple audiences, bringing in the resources of both of these government organizations. To do that, we relied on the services of our advertising agency partners who, again, as part of our model, donate all of their time to the Ad Council on behalf of our sponsors at no cost. And because this issue is so far-reaching, and because, as we know, and the topic of this workshop is the idea of equity and reducing some of those disparities, we knew we had to reach out to not only the general audience, but particular communities. And so we brought in 3 agencies and looked to them for their expertise. Burrell Communications, who focuses primarily on developing work for the African American community. Casanova Pendrell, who works primarily in the Hispanic community. And then Ogilvy and Mather, who I'm sure many of you are familiar with, who's done work in many communities, but has done great work in the general market. So we worked with them to develop communications programs to reach parents and caregivers primarily in these 3 communities. So what was the objective of our campaign? As I mentioned, we're really focused on messaging environment. Clearly, there are other things that can be done in this space. But we wanted to talk to parents and caregivers. They're the folks that typically have the most control over the food environment in their home. They control, in many ways, the activities of their children. So we wanted to specifically focus on them and to focus on both healthy eating and physical activity habits. We were very specific with what we wanted to achieve, ultimately in the measurable side of things. So first, we wanted to teach and provide the correct amount of food, so portion control. Secondly, we wanted to encourage parents to replace empty calories with nutrient-rich foods. And thirdly, we wanted parents to promote and provide opportunities for kids to engage in 60 minutes of physical activity every single day. We also had a separate campaign focused on kids directly, but for the sake of time and for the example today, I focused primarily on the parent component. Our primary audience, as you might guess, even though it is parents and caregivers, is on moms. They're the ones that are typically doing a lot of the shopping or doing a lot of the food preparation, are often shuttling the kids around or making sure that they're home safely. And we're focusing on moms with kids ages 0 to 7. Basically, the opportunity there is to start to shape the long-term, lifelong habits of these children over time. And as I mentioned, we have a special focus on minority and lower income populations. And all of the research that we did in developing the work, the strategy, the messaging, was done with all of these various audiences to make sure that the work that we're putting out there is resonating in a way that's meaningful to them, that's motivating, and most importantly, actionable. So when we started, the current situation, based on some of the research that we did, longitudinal research, showed that moms don't really identify a problem in their own home. This may not be a surprise to many of you. It really wasn't a surprise to us, but we wanted to make sure we had the information correct before we set out to develop our message. While they're aware of a problem generally in the country and they've heard about childhood obesity and the issues, they don't necessarily see it in their own kids. So we only had about 11% of moms describing their own child as being overweight, while we know the national average is 32%. It's actually creeping up still. There is a very small percentage who were very concerned about their children's weight, but far too small a percentage given the enormity of the issue that we have. That being said, there is an opportunity for improvement. Many moms admitted that they're not always doing a very good job of feeding their kids healthy food. Only 16% really felt confident in everything that they were doing in that space. And only 19% felt that they were doing a very good job in providing physical activity opportunities for their kids. So while they don't necessarily see a problem in their own home, they do admit that there's an opportunity for them to do better. So again, for the sake of time, there's so many insights I can share on a lot of these audiences, but I wanted to focus on a few and show you some of the work that we developed. For the general market audience, there were, again, a lot of things I could have listed here, but I think one of the most important is this idea that moms in general are unwitting enablers of bad health. So they think they're doing a pretty good job. They're making pizza and maybe they're trying to add a vegetable to it. But they really don't see a huge problem, like I said, in their own home. Their kid has recess perhaps at school, and so they're getting the physical activity they need. At the end of the day, they're really looking out for the well-being of their children, making sure they're happy, making sure they're doing their schoolwork, and they're not primarily focused on this issue of childhood obesity. There's a huge misperception that, living a healthy lifestyle, and particularly getting their kids to live one, requires these unsustainable, time-consuming, expensive chores, essentially. They feel like it's almost an adult activity to be healthy, so I have to join a gym, I have to go on an extreme diet. They don't really see the opportunities to provide a healthful lifestyle for their kids in a fun, meaningful way that the family can enjoy. And there's just a quote here from Tammy Barnes, who's 34. She's a nail technician in Connecticut, who basically said, being good, eating fruits and veggies, and going to the gym all the time is just not doable for regular, everyday people like me who have more important things to deal with. And that's the general consensus. So what is the message that we developed? So we really wanted to make sure that moms everywhere understood that other moms like them are in the same boat. They may not be focused on childhood obesity. They want what's best for their kids, but they are going that extra step to do what it takes to discover creative and easy ways to keep their families healthy each and every day. So what we want to do is make mom the hero. She's already the hero in the home to begin with, but make her a hero in the nutrition and physical activity space. And to our advantage, we had the Let's Move website, which provides a number of great resources for moms, whether it's recipes, giving them their kids places to play, being able to connect with other organizations that have cooking classes, family activities that can be done together. So the call to action in all of this work was to get ideas, get involved, and get going at letsmove.gov. So this is an example of one of the digital assets that we created. This is a web banner that would animate. And essentially, it's very simple, to the point, and again, makes mom the hero. It starts out with a simple piece of celery, some peanut butter swiped on, a few raisins, and ta-da, ants on a log. So you finish it with the stamp, Mom was here, showing that she is essentially the hero that provides this fun, exciting way for her kids to eat healthy, and provides a tease to go further to the website. Perhaps bringing it better to life is the TV spot.
Mom, can I have $1? Yeah, it's right. I think my purse is upstairs on the bed. It's not here. Check the dining room. No. What about your sister's room? It's not there either. The upstairs closet? The downstairs closet? There are no more closets.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
So there's a series of spots, there are multiple media channels. I just provided a few examples here. For the African American community, a lot of the challenges are very similar. Moms are moms are moms, basically anywhere you look. But particularly among the African American community, there are more immediate and pressing issues in the community, whether it's economic disparity, safety issues. So what we found there is that moms really want to make sure their kids are safe. They don't want to spend the limited time that they do have with their kids arguing over eating healthy or being physically active. They know that their kids might be a little bit overweight, but at the end of the day, they look at them and they see healthy, happy kids, and that's all they really care about. And the other thing that we're up against in this community in particular is the embrace of a more fuller figure. So you look at celebrity role models like Niecy Nash and Monique and Oprah, and they don't necessarily see weight as a real concern unless they're given real reason to. So the message here, again, is focusing on giving moms everyday opportunities to provide health and wellness for their family in a fun and meaningful way that doesn't create a challenge among their kids, and a focus on providing a better future, which we know all moms want, but particularly in the African American community, and again, driving to the letsmove.gov website. So this is an example of some of the print material we have here. Again, every day is an opportunity. Let's Move Monday, Walk It Off Wednesday, Small Plate Saturday, and I'll show you an example of the TV, again, to bring it to life.
Today is Saturday. Today is Saturday.
Salad on Saturday, fruit on Friday, double ball Thursday.
Water Wednesday, touch your toes Tuesday.
60 minutes of activity a day and eating well can help get your child healthy. So keep them active, because being even a little heavy could lead to health problems. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
And lastly, because I know I'm over time already, the Hispanic community, again, lots of insights to be able to pull here. The one unique part about this community is that while they had some of the same challenges of the other audiences I spoke about, they also didn't necessarily have a good gauge of whether their child was healthy or not. So they really didn't see being overweight as a problem. They actually celebrated that in many cases. And when we talked to them about body mass index, or BMI, they had no idea what it was, but they were open to the idea that there was this very scientific measure of whether their kid was healthy, and that we could focus them on that BMI measure and show them that by making sure that their children had a healthy BMI, they would have a better opportunity for a healthier future. So that was the focus of this particular campaign. And I'll show you, again, just the TV. There was a fully integrated program around this, but this is the TV.
En letsmove.gov aprenderás pasos simples para prevenir la obesidad infantil y ayudarlos a alcanzar un índice de masa corporal saludable. Visita letsmove.gov hoy mismo.
So the campaigns did very well, just under $45 million in donated media exposure in the first year alone. General market was just over 20 million, African American just over 20 million, and the Spanish language material just under 4 million. And just to put that in context, I know that the Spanish language looks a little bit low, but if you look at industry averages, 2010 general market TV and radio ad spend for general market was $37 billion. For the Hispanic community, only $2 billion. So if you look at the comparable numbers, we actually did very well in that Spanish language space. Also saw great movement in the website visits and engagement there, and we do have some awareness, attitude, and behavior tracking study data that shows that there is some movement in some of the key behavior areas that I can talk to you offline about. So that's all I have for today. Again, I apologize for going a bit over time. Thank you for the opportunity. Be happy to talk to anyone further afterwards.